Good evening. Tonight I'll be talking about two topics uh, related to problems of the musculoskeletal system. And the ones I chose, the first one is osteoporosis. If you notice, I drew a little drawing here of a bone, just representing, the bone, and shows that it is weak, and it has some brittleness to it. So what is osteoporosis? It's a medical condition where the bones become weak and brittle due to the loss of tissue. In the human body, the osteoblasts, which are responsible for producing bone, and the osteoclasts are then responsible for the absorption of that bone. This is known as remodeling. So whenever there's an interruption between those two, whether the absorption of bone is not there, that's what would cause the brittleness. So tests to diagnose this condition, testing for osteoporosis can't be done by a regular x-ray because it will not detect the osteoporosis until it is 25 to 40% of a calcium loss in bone. For this reason, the test that has to be done is called a quantitative ultrasound or a dual energy X-ray absorptiometry. These tests will measure the bone mineral density, which measures the peak bone mass and also the amount of bone loss. The manifestations of this problem are pain, bone fractures are easier to occur. Person's height shrinks. There can also be a visible hump on the back. The interprofessional care that would be provided for a patient with osteoporosis would be the management of foods that would contain calcium, supplements that would also include vitamin D, as well as encouraging the client to exercise, make him stronger, and also that will reduce the risk of a fall where he might fracture a bone. Drug therapy would also be included in this care. The treatment plan and medications used for this problem are bisphosphonates, which are recommended. They include alendronate, also called Fosamax, and Binosto. Another treatment would include monoclonal antibodies, which include desumab and also called Prolia, and rososumab, also called Eventi. Clients will be encouraged to do activities which would be outdoors to receive sun exposure to help with the vitamin D. Also weight-bearing exercises to get them stronger. Things such as walking, running is also encouraged with caution. And another big thing would be to encourage them to stop smoking and drinking. Nursing diagnosis, reduce physical mobility. Two desired outcomes. Client will be able to maintain the most physical mobility with the limitations that come with the disease process. Clients will have very few complications related to the disease as it progresses or moves on. Intervention number 1, assess all mobility functions and document any changes. This will help determine the next plan of care. Intervention number 2, provide clients with exercises that include those that have range of motion. This will help prevent bones in the joints to shrink as well as the muscles. The second condition that I'm going to speak about is the rheumatoid arthritis. And as you can see, the hand is deformed, bones shift. There's some swelling. There's pain also. This condition is an autoimmune disease that attacks the tissues. It will also attack the joints, which causes deformities, as we can see it right here. Pathophysiology, although the exact cause of this condition is not yet really known, it is believed that it is caused by genetics as well as factors that are in the environment where people live. It is believed that it is an immune response to an antigen. The diagnostic testing for this condition would X-rays alone are not enough to diagnose RA. For this reason, a bone scan is more effective to diagnose this condition. Clinical manifestations of this disease are fatigue, weight loss, also stiffness in the upper and lower extremities and joints. This is evident in the wrists, elbows, shoulders, knees, and hips. In the later part of the disease, there are deformities. Interprofessional care will include determining the activity level of the client, their joint functions, how they responded to past treatments, their age, family history of any of this condition, the rheumatoid arthritis. Care for this client will include positive coping skills as well as working on the client's self-esteem. Treatment plan and medications would be to manage his pain and keep it at the lowest or at the minimum. Keep the loss of joint function at a minimum also, and assist the client with self-care strategies for a positive outcome. Medications that are used for this disease are drugs that are anti-rheumatic. An example of this would be hydroxychloroquine, plaquenil, and auranofin Ridaura. A little bit hard to pronounce. Nursing diagnosis for this client, I chose disturbed body image related to physical changes. As we can see here, hand is deformed, and the client will be able to adapt to the physical changes that their body is going through caused by the disease. Client will be able to show coping skills as the disease progresses. This is the desired outcome. Intervention number 1, relieve pain associated with RA by providing clients with things such as a warm blanket, pillows, soft mattress. Intervention number 2, increase the client's mobility. This will be achieved by encouraging the client to move around as much as possible, but also encouraging periods of rest after completing an activity. Again, this is all done being very cautious, always assessing the client to see if he's able to or if he's not able to, and then make any changes according to how he feels or reacts. Client education for RA would be to encourage the client and their families to ask any questions that they might need answers to, or any clarification, or if they don't understand something. Assist the client with ways to deal with pain, fatigue, and depression, which come with this disease. Not for all, but some patients. Teach the client coping skills during the process of the disease. As we have seen, these two conditions are things that we do deal with, and thank you for your time. Good evening.